All right. Yeah, so we're going to go ahead and get started here. We're a few minutes after the hour. Again, I know I said it a couple of times, so please make sure you're signing in if you are joining right now, but I'm going to go ahead and get started. So welcome everyone to the Selikoff Centers for Occupational Health first CME course, a series of 2 courses. This course is focused on climate change and occupational health and is hosted by Dr. Nabeel of the Selikoff Centers. This is the accreditation and the disclosure statements that were provided to us by the Westchester Academy of Medicine. So this activity is accredited, and the disclosure statement is here on the right-hand side. The certificates of attendance will be provided following the completion of this activity once the evaluation forms at the end of the course have been submitted. So we have the sign-in at the beginning as well as an evaluation form at the end. Please complete both of those, and I'll share the link at the end of the course. Please sign in, like I said, at the link. And if you're taking this course for CME credit, you will need to complete the class evaluation at the end of the course, which I will share. All right, and our agenda for today, so the welcome and accreditation disclosure statement. Then we'll go into the course with Dr. Nabeel, Introduction to Climate Change in Human Health, Strategies to Protect Workers from Climate Change Effects, Future Work and Goals, and then we will have a Q&A. So just so everyone knows, there is a Q&A option in the Zoom bar. Those are anonymous, so just submit those throughout the course, and at the end, we will address any of those questions. All right, so a little bit about the Selikoff Centers of Occupational Health. So we are dedicated to providing cutting-edge clinical services focused on prevention for worker health and workplace safety. We have a multidisciplinary team that includes physicians, nurse practitioners, industrial hygienists, ergonomists, social workers, and specialists in workers' compensation and benefits. And our services encompass diagnosis and treatment of occupational diseases. We evaluate work conditions to assess risks to coworkers and recommend improvements, identify workplace hazards, and provide employer training and education, and implement effective workplace interventions for hazard mitigation. We have 4 locations. So we have a location in Manhattan, Staten Island, Yonkers, and Suffern. And with that, I'm going to go ahead and pass it on over to Dr. Nabeel.
Thanks, Daniel. I really appreciate that short, brief introduction too. Can you see the slides, I think, right? Hey, thank you so much for being part of this conversation. I think it's very, very important that we need to start to understand the impact of climate change, particularly on our health, and especially the connection with occupational health. It's very, very important. I'm part of the Department of Environmental Medicine, and we have recently changed the name to Climate Science. It's Department of Environmental Medicine and Climate Science at the Icahn School of Medicine. I don't have any disclosures, and we'll go through the talk in terms of how things are changing very rapidly as we see that climate is on the forefront of many things, and the understanding of how it's impacting our health is still evolving. So you must have heard a lot for a couple of years that the climate has been changing and it's impacting our health. And I think we are starting to see some of the impacts that it has on all of us. We have record-breaking temperature in Northeast and Midwest. We have frequent coastal floodings, we have prolonged droughts, damaging winds and storms, and there are stormwater surges. So there's definitely a change that's occurring that's undeniable. And for past almost 100+ years, we're seeing that there's a continuous increase in temperatures all across the US and across the world. I always go back to this graphic, which is just astounding. This takes you all the way from historicals, 1981 to all the way to projections to 2099. And you can see the southern part of the country will continue to get really heated up, and it will move into the northeast part. And this transition, this change has been fairly progressive. We have seen that the past couple of years, we're seeing more and more years where we have significant increase in temperatures. We're recording one of the hottest months, hottest years that we have ever seen before. So that change continues to make our country much more warmer, even from southern plains to all the way to the northern parts of the country will get extremely hot unless we do something about it. And the impact is all over the place. So I confess that I enjoy water. I learned how to swim as an adult, so I enjoy this activity a lot. I used to reside close to Cape Town in a place called Dartmouth, Massachusetts. And this is the southern coast of Cape Cod. We're looking at two different images, one from 1984 and other one was actually 2007. And you can see that there's the whole coastline has been impacted by these surging waters and changing temperatures. And this is actually older images. We are now seeing a significant change in a more rapid fashion that we have ever seen before. And this is heartbreaking. And I think that we all have to take into account what's been going on around us. I go back in time and look at the time when I was born. And I was born in a southern part of the country in Pakistan, a place called Karachi, which is a southern tip of Pakistan, which is closer to the equator. And as you can see in this graphic, as I grow older, there are more days that I'm seeing more than 80, 90 degree temperatures. And as I move up to the age 80, we're going to have a significant amount of days where their temperatures will not be below 90 or 100 degrees. And I think it's very concerning for all of us in the near future that this change is coming, and how we're going to adopt our lifestyle or work around it as the change is evolving. I reside now in New York City, and we have seen a huge increase in the temperature. Overall, it's been climbing, and since urban city has a lot of concrete, it gets heated up, and there's heat islands that we see, which has a significant risk on human health. And what does that mean in terms of our own work? This is a very small perspective from a microcosm of looking at ED visits. And we can see the ED visits continues to rise, but the temperature rise, if it's exponentially hotter, we see a significant increase in emergency room visits for patients when the temperatures start to climb up, which is an important aspect to understand. We do have limited resources, but if there's sudden change that's occurring and it impacting a huge amount of our community, it's hard to corral all the resources that we can get to take care of this population, especially the impact of heat, which is immediate. So I want to highlight heat as an important factor that we're seeing in the story of climate change and its impact on health, because it's much more visible and you're all experiencing it. But the climate change itself has a very significant effect on multiple factors. There are different drivers of climate change. There's also exposure pathways secondary to climate change. We just talked about the heat, extreme heat, but there's also poor air quality, changes in infectious agents, population displacement, and then it has a direct impact on human health with heat-related illness that we have seen in our patients. We also have a cardiopulmonary illness food and waterborne vector illnesses that are on the rise. And we also see an impact on mental health. And then there's a social and behavioral context of what we've been seeing across the board: age and gender, race or ethnicity, poverty, infrastructure. So every single element of our life has been impacted by what's happening to the climate. But the understanding of this impact of climate change on health has been very challenging and difficult, because the little bit of exposure we all have during our daily lives, then we have an adaptive capacity to absorb that exposure. And then the determination of how we react to this exposure is determined by sensitivity and vulnerability. So it's a complex understanding of how climate change impacts all of us, or individual beings, and then how it impacts more of a community or population. And that's the challenges that we face in terms of making this a connection between climate change and human health. But all of the communities across the board have been impacted. The only community missing here is working communities, which I think all of us are part of, but community of color has a differential impact. Older adults have different vulnerabilities. Kids and low-income communities have very challenging exposures to changing climate, and it could be assessed as we move into seeing more and more calamities and climate events. So I want to highlight, again, going back to the heat example, is what is the impact of temperature changes on our health, and especially mortality. So if you look at two places, Boston and Buffalo, Buffalo is basically considered fairly cold. Boston is also up there as cold place. So talking about the change, if we see a change in the temperature, just a minor change in the temperature, we see a significant spike in mortality in these areas, because we are not have adaptation strategies yet fully incorporated in our health. But if we look at Baton Rouge, Louisiana, or Brownsville, Texas, people are more likely to be acclimatized to changing temperatures, so tend to have a less steeper curve of mortality that we see in these two places compared to Buffalo and Boston. So that shows a significant impact. It's the rate of change that we're seeing will have a tremendous amount of effect on human health, and I think that's a very important point to think about this here. And so all of our lives, we have been building houses. We enjoy outdoors. Construction workers, there are specific jobs that are exposed to heat-related illness. That's very common in construction fields, where the majority of time they're spending outside. But the challenge is that we have seen an exponential growth across all outdoor works. From leisure to hospitality, since the pandemic, there's been a gradual and incremental rise in the number of jobs that's coming out of leisure and hospitality. We have seen a lot of construction work that's been going on. We have an increased transportation and warehousing that we are seeing an increase in that. As we are more people on the planet, there more emphasis on growing more, and more agricultural, forestry, and fishing has come up. But this important thing that I want to highlight is the mining and quarry or grass exploration ideas. As we move more into a economy of scale, we're looking at electrification of our grid systems, electric cars that are coming on. So there's more and more desire for mining, for lithium ion, to construct batteries and other things. So and that also impacts our utility, because our grid systems will be impacted by the number of electric cars that we drive and all of it. So there's a transformation occurring, but also there's a job growth that we anticipate, particularly in outdoor areas, a lot. But the challenge here is what if the temperature outside is 90 degrees, like in 6 or 7 a.m. or 100 degrees at this time? You basically push the timing of when you start working much earlier, 4 a.m., 3 a.m. when it's colder. And when there's no reprieve from the hot temperature, even after in the evening when the temperature continues to be elevated, that has a substantial effect on our productivity. So from farms to ranches, construction site, utility companies, installation, maintenance job, repair jobs, all of them are impacted by how the heat is dictating that you start work really, really early. And who has not seen the workers working in the field, working in your backyard, where there's 100, 110-degree temperature outside? We live in New York City, New York, which is relatively has a little bit better temperature than southern states, where temperature goes up fairly exponentially, and then you stay indoors most of the time, not enjoying the outdoors because temperature is too high. So we started to understand this phenomena by tracking heat and health trackers that CDC has released, and we are starting to put numbers together to find out what is heat-related illness, how it's impact emergency room, and what the number of people that are impacted each year by heat-related illness. But our understanding, again, at the population level, still continues to be fairly limited. But this is not the effect just in the US, but across the board. So people are dying from heat illness, particularly in countries where there's a significant amount of sun, particularly Qatar or Emirates, where they're experiencing longer days and extreme heat. Yeah, we see heat exhaustion, kidney damage. You see injuries due to hot environments, and this is across the board. This is from Europe to Far East to Middle East, and in the US, that we are seeing a significant change of our behaviors due to extreme heat. So in terms of what is going to be our productivity, what is our labor capacity, there's going to be a significant decline in the number of hours that we work, because we don't have time to work during the daytime, because it is extremely hot and your productivity goes down significantly. Just between 2018, the US labor productivity declined by 1.1 billion potential labor hours due to extreme heat. So this is definitely will impact our economy at scale. And then again, there's a multitude of variables in this equation. Not everybody is impacted the same way as I mentioned earlier. Our tendency to respond to heat-related illness or heat itself, we have a built-in resilience that we tend to develop, but there's other factors like temperature, humidity, wind speed impacts us differently. There's also other characteristics like socioeconomic characteristics or activity patterns that influence our impact from heat to us. And then the very important point that I want to make here is acclimatization to the changing environment is very, very important. So workers who are working outdoors for a few hours, who've been in the heat, and then they get exposed multiple times to this changing environment, are much more resilient compared to workers who are not exposed as much. And especially if we take the case of agricultural workers. So a majority of the states have some degree of agricultural workers who work in these areas from southern state to the Midwest. And I think the impact is significant. And simple measures helps in minimizing the impacts of heat on these workers. For example, workers can take shorter shifts, adjust their body to the heat that's happening, the changing heat. It gets stayed well hydrated, that's important, and watch for signs of other heat-related illness. And it's taking time to cool down is very important. And we need to start to quantify this. This is a proposed rulemaking summary from OSHA, which is looking at potentially making this an important aspect that we need to think about heat illness prevention campaigns, where we saw an increase in fatality, we saw an increase in work-related deaths because of heat-related illness. And across the board, we're seeing studies that shows that there's increase in traumatic injuries. Outdoor workers, agricultural workers in central and eastern Washington has more traumatic injuries, and they're reported injuries when there's more days when there's much more hot outside. So definitely we will see an increase in injury rates as well, which has cascading effects on all of us. So there's a direct tangible effects of heat and ultraviolet rays. Particularly we see it in agricultural workers. There's acute kidney injuries that we see people working in summer months. We also see a change in basically the hydration status of these workers. So the impact is felt across the board whenever we look at summer months, and especially working outside and outdoors. And this is especially true for nephrolithiasis, the condition where you produce stones in the kidney. They're more likely to see a direct impact of heat on this condition. And think about the majority of us, if there's acute issues with kidney injuries and renal failures, how many more people will not be able to do the job or will be considered disabled? So I want to move on to many more threats that we see across the board. So they're not only rising temperature, but they're extreme precipitations, heavy downpours that we see in the East and the Midwest area. There's been flooding across the board in Midwest and Northeast. And we have hurricane risks down in southern states, particularly Florida, Texas. We have rising sea levels in the southern states. And then we have droughts in the California area, heat waves, wildfires up in the northern plains here, and high temperatures. And wildfires basically is a very interesting and very dynamic situation that happens every summer. And now we're seeing more and more stories about it. It has a direct impact on all of us. It's with mental health impacts on it, and especially if you look at the suicide rates among farmers who are impacted by severe drought conditions, there's a positive association between the two. I want to highlight something that is very closer to my heart, is the workers who work with us during hurricane season, and especially the paramedics, first responders. They are severely impacted by the work, and especially the stress and mental health is at risk for these individuals. This gets summed up in a statement that was made by one of the paramedic, Greg. He says they show up to work and keep working, likely with the knowledge that their living rooms is under 2 feet of water, and their families is driving hours away or attempting to ride out the storm on the second floor of the house. How significant, profound that statement is, even though these guys never stop working and continue to rescue people across the board, but their own families are at peril when these events are occurring. Switching gear again, there's a very important thing to think about is air quality and how we breathe our air. One thing that is very important to understand is wildfires not only impact one community, one segment, but actually it's been across the board, and it moves and shifts in a way that we have never seen before. So the wildfires that continues to burn has a direct impact on air quality that we all have. And this is just trying to give you a perspective of how much wildfires have been in recent years, that we are seeing more and more of them. If you've never seen the movie called Only the Brave, I highly recommend it. These are firefighters who fight fires. They were granite mountain hotshots. They all perished except one. Um, and they were involved in fighting the fires. This is a true story, but it really highlights the perils that the first responders, the firefighters, take on when they are one of the elite groups of firefighters to go in to take out the wildfires, which can ignite and change and move and shift in a way that is unpredictable. It's a fascinating look at what the job entails for these elite hotshots, they call it, in firefighter community. And who can not miss the changing New York skyline last year during Canadian wildfires? Just to give you a highlight, this is the New York City at its best, and it was completely engulfed with the smoke and soot that prevented us from doing our daily routine. And this is just a time-lapse photo of the same place, which is completely invisible to us with the amount of dust and soot that was created during the wildfire. I happened to be I came to work and ended up looking at this in a different light. I worry about the workers who are delivering goods and food to us. And also, if you look at the background, there's a significant amount of smoke-like situation here, which directly impacts the asthmatics, people with COPD or respiratory illness. I myself ended up using the 3M mask because the soot were, even though I don't suffer from asthma, it was bearing down on me. So thinking about COVID and then thinking about climate change with soot and smoke outside, it's hard to breathe. And it reminds you of how precious our environment is, and it will be difficult for us to survive if you don't take care of it. Moving on to another big threat, we talked about the southern states, Texas and Florida, where we see a huge monster storm brewing. This is Hurricane Harvey in August 27, 2017, where it impacted a lot of communities, and a lot of people were displaced and moved because hurricane winds and this sheer amount of power that the hurricane carried at the time. This is a time-lapse video that I want you to see. This is 911 calls coming from Houston and then subsequently Beaumont and Port Arthur area. This is Houston, Texas. The challenge I see here is the shifting requirements and challenges that we see as the storm waters or storm direction shifts. And then it becomes much more evident that we are losing control of our first response, because it's hard to get to people. There are nowhere to go. The people are, one person is quadriplegic, mother of 8, bedbound, I'm stuck in the attic. And this reminds us of how significant this impact is to communities of color and all of us. Moving on, I want to talk about the spills and exposures that comes with it. As this floodwater recedes, you also see, particularly in Houston area, there's a lot of chemical plants out there with oil. There's a spillage of oil here that we see, and this is because we have a lot of areas, particularly in Texas area, that we see a lot of facilities which has toxic chemicals that are there that can impact us in a way that we have not seen before. So
news at that chemical plant in Crosby, Texas. Chris Van Cleve is there. Chris?
DeMarco, we are more than a mile from the plant. You can see the plume of black smoke. We can see the fire from here. We understand it is a very intensely burning blaze. At least 2 of 8 remaining tractor trailers that contain organic peroxide have exploded. This was expected when the refrigeration units quit during 4 to 6 feet of flooding. The chemical plant knew this was going to happen. They said it could happen at any moment, and late this afternoon it did. Yesterday, one of these trailers went up. Now at least 2 of them have exploded. This is an intense, big fire. This chemical plant has a host of potentially very dangerous chemicals. Executives told us those chemicals are far away from where this fire is burning, and fire crews say they've got to just let this fire burn itself out. It's too dangerous to go in. That smoke is an irritant. That smoke can create some breathing issues. We know on Thursday at least 18 first responders were taken to the hospital with a variety of issues, and yet we were able to get right up next to the plant today, even though it's inside an evacuation zone, and there were many people we saw trying to get back to their homes who live near that plant. This is why first responders are keeping people back, as this fire has to burn itself out. And remember, there's 6 more of these tractor trailers that have yet to go. DeMarco?
So I wanted to highlight this issue of after effects of hurricanes and other disasters, that there are areas that are become unstable. There's exposures that are significant, and especially for first responders who are going into these areas, there's a significant amount of impact on their health. And unless we take an adequate history of what happened, there are long-term impacts of these exposures to these individuals, and that's very important to understand. I want to highlight another catastrophic event that was on February 2023. Ohio train derailed. It was a catastrophic derailment in East Palestine, Ohio. What transpired afterwards is the train was carrying harmful chemicals that got spilled in the community, and most of the people in the community were impacted by the toxic substance. And that
tonight,
also,
a toxic threat looming over this eastern Ohio community just outside Pittsburgh. The volatile and dangerous scene forcing first responders and investigators to stay back as they try to determine how this happened and why.
We have obtained 2 videos which show preliminary indications of mechanical issues on one of the rail car axles.
Some 2,000 residents ordered to evacuate, and tonight sheriff's deputies are still going door to door, urging residents to get out.
I can't stress enough that if you are in the evacuation zone, you need to leave.
NTSB investigators now say 20 train cars were carrying hazardous materials, 10 of which derailed, though they aren't sure which cars, if any, have been compromised.
I saw this big, huge flame. A police car came up and said, evacuate, evacuate, evacuate.
The massive fire still smoldering as fears grow around dangerous chemicals that were on board. The NTSB says 5 of the cars that derailed were carrying vinyl chloride, which is associated with an increased risk of certain cancers. Officials say air quality and the water supply, which are being monitored, remain safe. But the Ohio EPA says some material entered local waterways before containment measures were in place.
We are not aware of any elevated readings that we would anticipate to have impact to human health.
Tonight, a state of emergency is still in effect, forcing businesses and schools to remain closed.
We are still not conducting any on-scene operations. It's still too volatile of an area.
Megan Fitzgerald, NBC News.
So just to give you a perspective of how the event can impact communities, populations, drinking water, and the impacts and effects are still unknown for many years to come. This was the event that took place. Of course, it's not connected to a national disaster, but something that we have to account for because the chemical release or leak, as I showed you earlier during hurricane. Other hurricane events, we can also see some of this similar challenge while transporting toxic or hazardous chemicals. There was a lot of chemicals that was transported, and the communities that were living close by were definitely impacted. Some of them can potentially cause cancers in the long term. Vinyl chloride is basically a commonly used substance in pipes, wires, cable insulation. and it does not only produce irritant to the lung, but also can cause other harmful effects to human health. I worked with some of the folks on the ground during Hurricane Harvey in Houston. I've privileged to work with Brett, who was an assistant professor at University of Texas, and he started a small program where he distributed N95 after Hurricane Harvey because he saw the impact of respiratory illness among people who have been impacted by after Hurricane Harvey. And part of it is the sheer amount of trash or stuff that came out after the houses were condemned with significant rain and hurricane events. We decided to really understand this issue in a much more comprehensive way. For past many years, we've been working together with others at University of Texas and Icahn School of Medicine to help to build a product called Pocket Arc, which is funded by NIEHS. It's actually involved in helping the workers who work in these communities to understand the health and safety issues affecting them while they work with hurricane-affected areas. The work itself affects the workers, community organizers, public health agencies, and we are trying to give a more comprehensive way of understanding what it entails. It's a micro-learning environment for workers who goes into these flood zone areas, and we need to understand that what are the health risks these individuals have overall, and how we can inform them about safety solutions, basically to prevent health-related effects. The app does a good job of highlighting what the N95 respirators are, heavy-duty gloves are, when to use the watertight boots, and how to get protected against flu and other illnesses, and hepatitis B and others that could impact them. We also help them figure out where the job sites are and what are the threats associated with the job sites. So it provides you with the readiness plan, training, a formal way of helping these workers get the required training that they need for being deployed in such a different precarious environments. It also helps the employer to understand the risk associated with the job sites and what can be done for workers and how ready to deploy the worker is in terms of safety trainings are concerned. We also saw an influx of additional information like COVID-19. This work went on during the pandemic. We got additional funding to help understand if COVID changes the way we support protection of workers in these communities. And then we continue to understand and learn more about how infectious disease and other things can impact these workers who are going into these disaster zones. The work doesn't stop there. Recently, we also we had a collaboration with the CUNY City University of New York together to look at this question of climate change and its impacts on health. Here you can see this is a collaborative work where we look at sensors. These are flood sensors across New York City, and try to figure out if these areas which are impacted by flooding has a direct impact on acute respiratory illness. There's some growing evidence that the micro floodings that we see in New York City tends to impact human health in a way we have not understood before. So there's more work to be done, of course, with access to care, and it has a direct impact on acute respiratory illness in some situations. moving forward with what the future is and how we can address changes at workplaces and for workers, one of the important things that we need to understand is we need to listen to our workers. We need to understand health and safety issues that they are facing outside. Simple question about where do they work and how they're experiencing the changing climate is very, very important to drive solutions for them on the ground. They have a direct insights. They have much more better understanding of how things are going on the premises, and I think we can intervene at that moment. We have other employers, big employers across the board who have been impacted by climate change, and there has been an impact on their workforce. So bringing them into the fold is also important to help improve prevention control measures for health and safety at the workplace. This is a small work that we did for risk mitigation, especially for first responders. We looked at both the small businesses and big businesses and see what best practices we can have to help mitigate some of the challenging issues, for example, respiratory issues, vector-borne issues, exposures to biologics or non-biological agents, and changing mental health issues. And this was published in the Journal of Occupational Environmental Medicine. And so a small way to demonstrate that we can make changes in the workplace or things that can help these workers tremendously. We also have to look at education infrastructure, security, incentives. We need to influence our policymakers in Washington to help define mitigation and other strategies for resilience and adaptation, both at local, regional, and national level. There are a lot of future work and goals, of course, in this area. It's still a burgeoning and an evolving field. And research is very, very important. We need to think about interventional based research where we use engineering and administrative controls with differential PPE or innovative PPE that can protect against different elements, different exposures. We have to disseminate the research that we have already. For example, the impacts of heat and heat-related illness across the board. It's now well known, and we need to formulate a policy around it to protect workers. That's important. There's also organizational research that we need to do to improve our programs and methods and put innovations in practice. There's other basic science research that I think is fundamentally important. We are changing to our core by sheer exposures, the climate change that we're seeing across the board. There's a huge need for basic science research as well as applied research and ecological research to be done to see the impacts of greenhouse effects on different worker population like construction workers or other individuals. So there's a lot of elements to the puzzle that is still missing and not completely addressed. We do need collaborative work. In our profession, we work with occupational health and safety and industrial hygienists, technical institutes. We work with local environmental organizations to improve and promote sustainability across the board. There's a lot of work need to be done in surveillance and collaboration to help mitigate this tremendous issue that's not feasible or possible at the individual level. We're doing our part. I host a occupational medicine focused podcast where we talk about climate change and its impact on human health and particularly workers' health. So this is one of the episodes that you can look at that actually addresses hurricanes and floods and climate change itself, which has impacted all of us. Thank you so much for taking the time. I'm open to questions.
If anyone has questions, please just put them in the Q&A. And again, just thank you first of all, but thank you, Dr. Nabeel. That was absolutely incredible. So yeah, and I just want to make sure that everyone knows that please sign in at the link, and I'll share the evaluation link in just a bit. But Dr. Nabeel, here's one question. So are there any resources we can guide patients to where they can get more information on impacts of climate change in their health?
Yeah, so CDC, as I showed, have now a health tracker. We have other government-based organizations or information resources that can really help you understand some common challenges that you face with changing environment. CDC site is one area that definitely has been helping patients, workers to understand that the impact. We have National Institute of Occupational Health and Safety, which actually publishes on the impact of climate change and work. That could be a good resource. And certainly during the hurricane events or local catastrophic events, I think the local health offices, New York City and others, put out a really good information for all of us to understand the risks and how we can mitigate those risks. I'll give you one good example. At the time when there was Canadian wildfires that were impacting New York City, I think the governor's office as well as New York City Department of Health published some of the very good resources to protect, and especially targeted to patient populations which are vulnerable to these events. We saw a substantial increase in ED visits during that time, especially for kids and others. And in some areas like Bronx, there's overwhelming number of people who showed up at the emergency room. So I think that the information is the key to help mitigate or reduce the exposure. Simple mask that I wore at the time really helped with some degree of exposures, particularly to particulate matter, the PM 2.5 that we see in smoke related illness. So there's mitigation efforts that we can address, we can do, and there are resources available all across.
Thank you, Dr. Nabeel. Let's see. What are some of the best ways to get involved, make an impact as a medical professional at Mount Sinai Health System, in addition to patient care? And that could be inside and outside of Mount Sinai.
Yeah, so one of the things that I always ask, again, I work in this field, and the question I always ask is, what kind of work do you do? And what are the simple things? How much time do you spend outdoors? What are your exposures? And the answer is different and very interesting on different patients that I see. So state trooper who's been in the car long hours. You have construction workers who have been working on a building, yeah, or workers who work with building the infrastructures. Usually they work at night, and usually that's how they perform their essential functions of the job. So it's a very interesting question, and it allows us to dig much deeper in terms of what the exposure could be and how I can address the challenge that they're facing. Give you a couple of examples, particularly people with diabetes and other conditions. They are impacted differently compared to others. The shift in temperatures might impact them in a different way because the medications they are taking, the disease that are advanced. We can certainly make a really good, we can really help them understand the risk of climate change and how they can address adaptation strategies or mitigation strategies to prevent impacts of climate change on their health.
Yeah, thank you, Dr. Nabeel. And before I ask the final question in the Q&A, I'm going to go ahead and send the evaluation link. So this is different from the sign-in link. Please complete this evaluation just about the course. And then the last question, Dr. Nabeel, could you tell us a little bit more about your podcast, the OCPod? What topics have you covered recently? Yeah, just tell us a little bit more about it.
Thanks for asking the question. So it's one of the ways that you basically spread the information across, and I felt that was a much more powerful tool in our arsenal. It's simple conversations. Anybody can join in. It's available on all platforms, from Spotify to Apple podcast client. So the best news here is that you don't have to download a program. It's already on your phone. You can just fire it up and listen to the conversations. And we had some really amazing individuals from across the country talk to us about the work that they're doing. From the southern states, we looked at heat-related illness, also Horizon BP disaster, where there's an oil spill in the Gulf. Some of the workers who worked there. We have an episode on the firefighters in California that have been involved in taking care of wildfires, which is a fascinating look at how the work gets done and how challenging it could be in ways that you have never seen before. And the other thing that I want to highlight, the work we do with University of Texas, the Pocket Arc, we actually was able to look at these vulnerable working populations that are working in different southern states. They come from different parts of the country, and they come together. The challenge they face is they don't have the infrastructure, the language sometimes, or the resources to really help communities. But they are the work is ongoing at this point. So there are different and diverse topics across the board that we have tried to cover and continue to cover, with the focus on occupational health, occupational environmental medicine, and the topics related to climate change, how it's impacting the health of a worker. It's our focus. There's so much to learn.
Yeah, thank you, Dr. Nabeel. This is a really great presentation. I definitely learned a lot. I'm sure the audience learned a lot as well. Are there any other final questions, comments? Give it a couple minutes again. Just a reminder, please complete, everyone. No matter if you want the CME credit or not, if you're in the course, please complete the evaluation just so we can review that. But yeah, I'll give it a couple more minutes if there's any questions, and give people some time to complete that evaluation. Yeah, is there anything else you wanted to add, Dr. Nabeel?
I think depending on where you are, you're taking care of patients, and I think add that question in your history, like ask about the job that they do and how much impact they have. Sometimes simple things can give you information, ideas about workers that you never had. When I was working in Boston, an hour away from Boston, I come across a patient who was suffering from asthma-related illness. And one of the things that I ended up asking, and he was noted to be disabled, but he told me, like, during summer months, he'd take on jobs at demolishing houses. And he was recently working in an area where there was a mold growth, and that was impacting his asthma symptoms. So there's some subtle things that you can pick up, and it's important to start to address those as we see more and more of that things happening.
We got another question. So are you able to share the slideshow and cited resources?
Yeah, of course. That's not a problem at all. Yeah, sure.
Okay. And if it isn't an anonymous attendee, so if you could, I'll put my email in the chat. Just send me an email and I'll make sure that I get those slides to you after discussing with Dr. Nabeel. All right. I want to thank everyone for joining the CME course. I want to thank Dr. Nabeel for putting it on. This is a great presentation. And if anyone has any questions, feel free to email me. Again, my email address is in the chat. Please complete the evaluation, the sign-in. And as a final announcement, this is a series of CME courses. So 2 courses will be happening. This was the first, and the second one will be happening with Dr. Kumar Lingam, and that one is focused on heat stress in the workplace. And that's taking place next Thursday on the 9th from 1 to 2. And since I'm putting a lot of links in the chat, I'll go ahead and put the link in the chat for that registration if you would like to attend that course as well. And we hope to see you at that course, and thank you all for joining.
Thanks so much.
Yeah, of course.